Well, this is an ultrasound study relating to the kidney urinary bladder, that of the 60 years old patient with the complaint of burning maturation only and retention of urine. For the last few days has been catheterized. Now this is the upper pole of the right kidney. This is the mid region, and this the lower pole is showing you a solid, complex, cystic and solid echogenic area, cystic mass measuring approximately 11 into 7 centimeters, with the central area is seen to be cystic, and the periphery or the area around this linear cystic area is echogenic. This is the outer rim, echogenic, and it relates to the lower pole of that of the right kidney. This is a complex cystic and solid mass relating to the lower pole of the right kidney. Now this is the upper pole. Mild hydronephrosis is seen. Minimal telangiectasia is seen. This is the right kidney, and we see that the parenchyma of the right kidney is showing mild raised increased parenchymal echogenicity, corticomedullary differentiation of the upper pole, and that of the mid region is intact. Minimal hydronephrosis is seen, and why I'm saying that the kidney's parenchymal echogenicity is raised, because under normal circumstances and in normal patients the echogenicity of the renal parenchyma is either equal to or less than that of the adjacent normal liver, provided the liver is normal. So this is upper pole, no calculus seen in this region. However, mass effect from this large cystic mass at the lower pole of the kidney is the cause of this minimal telangiectasia, this minimal hydronephrosis. Now this is the, let us study the mass only, and another thing is that we do see fluid. This is the fluid posterior to the cystic mass. This is the iliopsoas muscle, and it glides with the kidney. You can see it is gliding with the kidney with respiration, and when I give a full sweep to the probe, it does not change its shape. Significant no change in shape is seen. Internal configuration is that of multiple septations, cystic and solid areas within it are seen, and appears to be you see, this is the configuration appearance, internal appearance of the mass, cystic mass. This is the septa. This one is the complete septa. This is an incomplete septa. This is the debris and septation with the dependent region of the cystic area, in the dependent region of the cystic area. Now this is all solid element within this cystic area. Now this is the clear portion of cystic area. These are the echogenic areas, and you can see posterior wall enhancement from the cystic area, cystic mass. The reason being, now you see this right echogenic area posterior to this mass is representative of strong back wall or increased through transmission, or what we call as acoustic enhancement. So there is acoustic enhancement, and there is fluid. The fluid is not in the hepatorenal angle, rather it's in the it's seen posterior to the kidney. You have to see that whether it relates, if there is any fluid in any part of the patient. Now this is the cystic mass. This is the fluid. This is the fluid. Excuse me, while writing I am making some mistake. Cystic, sorry. Okay. Now, together. If we keep this on the one side of the screen and then we see the other kidney, you see that this kidney is clear of any poppilian, no calculi, no hydronephrosis is seen, and the spleen is normal, no fluid is seen above the diaphragm. Now here is the prostate of this patient. He is catheterized, you can see the cath bulb, and the measurement, the prostate appears to be enlarged. Let's see what are the dimensions of this prostate. It's about 66 grams, and normal is, normal is up to 40 grams. So this is a mild enlargement of the prostate gland. This is the prostate gland in longitudinal section. This is the prostate gland in transverse section. This is the prostatic urethra in transverse section. This is the urinary bladder. The wall of the urinary bladder is not thick. This is the catheter bulb. So this is the prostate. This is the prostate in transverse section. This is the prostate in longitudinal section. Now this structure, this linear bright structure is the actually cath and tube, cath tube. This is the catheter bulb. So there is mild prostatic hypertrophy. Now, is there anything in that region of the porta hepatis or para-aortic region? Any lymph nodes? No, there are no lymph nodes seen, and the para-aortic region is clear. This is the portal vein. This is this liver. एक लंबा साल है कि सालों को लंबा साल हो. So okay, no fluid seen, and anterior to the diaphragm. बस ठीक है, आराम साल हो. And this is the you see it glides over the ileus most of the cystic mass. So this is our case of the day. Thank you very much.